Greetings. Welcome everyone. I'm Jed Shlackman. I work as a holistic mental health counselor, and that includes working with hypnotherapy and energy healing and other mind-body type healing modalities. In this video, I'll be speaking about the topic of ADHD medications and also holistic and alternative approaches to helping address challenges or concerns for those who've been diagnosed with having so-called ADHD. And to begin, I'll just preface this with a disclaimer that the video is for educational purposes, so this is not intended to replace diagnosis and treatment by qualified healthcare providers. And now on to our discussion. I'd first like to speak a little bit about our nervous system in general and how we function as human beings. When people are given an ADHD label, the label is based upon particular symptoms that are observed about how the person is acting. So it's based upon behavioral observation. It's not based upon any biomarker on a particular blood test. Even testing electrical activity of the brain isn't usually done. And even if it were, you would just be seeing patterns of activity that are present in everyone a certain amount of the time. So it's not something discrete where you can separate people who have a particular disorder or disease from those who don't. It's something that's somewhat subjective based upon observing behavior and comparing how often you see a certain type or pattern of behavior relative to a population norm per se. So in terms of the symptoms are symptoms of hyperactivity and symptoms of difficulty with attention or concentration. So these are things that can appear to some extent in any person in certain situations or environments. So there are times where anyone could appear highly active and impulsive, or they could appear like they're not listening or concentrating well. So these aren't things that only a person given an ADHD label might appear to exhibit at one time or another. The ADHD label is given when a person is perceived to be excessively or chronically displaying the particular symptoms, and also that it's apparently interfering with their functioning in some way, with their ability to function at school, at home, in their job or workplace, and so on. So there's the environmental context. If a person is acting in a certain way, but their environment is actually supportive or congruent with that type of activity, then no one's likely to label them as having a problem. But for example, if you're not listening well, if you're focusing on too many external distracting stimuli per se, and you're in a school classroom where the teacher's expecting you to listen and complete an assignment, then they'll start to think that you have some type of problem. So we can keep that in mind as well as we explore this topic. Now, with our nervous system, there are a couple of basic pathways of activity of the nervous system. There's the sympathetic and the parasympathetic. So sympathetic is kind of like the on switch to be more active, more alert. So it's like giving you this rush of energy so you can take more action, you can use your attention more. It's getting you into a more aroused and alert state that is useful for some daily activities. So if we have a job to perform, if we're studying, if we're doing some type of physical athletic competition, we need to be aroused and energized. We need to be active in that sense. However, we also need time to rest, to relax, to digest our experience. So there's the parasympathetic, which is the slowing down, the calming down of our activity so we can kind of refresh and replenish ourselves. So we need a healthy dynamic balance of both. If you're chronically active, if you're over-exercising, overthinking, you get depleted, right? So you need a phase to rest, to replenish, to recover and rejuvenate. So if a person is under a lot of stress, whether that's psychological stress, so they have an unsafe environment, if they're experiencing a lot of criticism, a lot of bullying, a lot of uncertainty or insecurity, their nervous system might be in that hyper-aroused state where they're constantly on guard, they're constantly looking around for danger, they're being distracted by things. So in that case, it's kind of depleting their nervous system, and while for part of the time they might be able to focus, their attention is able to be directed towards something, it gets to a point where they kind of crash, where they're depleted, they run out of the energy, they run out of the neurotransmitters, and they're not able to focus. Their body wants them to rest, to let go and not be so active anymore. Their body needs to kind of reset and replenish itself. So in that case, if you just give someone a medication to stimulate them, you can temporarily kind of compensate for the state they've been in, but then they're going to have an even worse crash after the medication wears off. So we can think of short-term effects versus long-term effects, and we can think of looking at symptoms and trying to manipulate things on a symptomatic level versus getting to the underlying causes. What are the psychological and biological stresses that might be triggering or leading a person to display this supposedly imbalanced pattern of activity? So the different medications that people take for ADHD and various other psychiatric diagnoses, they're all designed to in some way impact the activity of various chemicals in our body, of the different neurotransmitters. But our body and our mind, in a synergistic way, working together, have their own self-regulation system, their own way of maintaining their balance while adapting to or reacting to the environment and any stresses that may be present. So there's this vast intelligence at work, this incredible wisdom that your body has to synthesize and manage and regulate all these many different chemicals that are present in the body to manage our level of activity, the stimulation or calming of the nervous system and our different physical and mental functions. So to a great extent, our body knows better than any doctor what it's doing and how it's trying to regulate these things and maintain some sort of relative equilibrium where things don't go too low to one extreme or too high to the other extreme. When you start trying to manipulate the chemical state and the behaviors with these drugs or medications, whether it's with prescription medications or recreational drugs, you're creating the danger of ending up at one extreme or another. You're increasing that danger by using any of these different medications, even though you may think you're helping things out with the short-term effect that you're eliciting. In the long term, you may actually be impairing the body's own self-regulation capabilities. You may be triggering it to disrupt its normal way of balancing things as it tries to adapt to these foreign chemicals that you're putting into your body, chemicals which, from your body's point of view, to at least some extent, represent a toxic burden that your body needs to clear out. And there's a few different ways these different medications can function as they are attempting to create the short-term shift in the activity of chemicals in your body. So for ADHD medications, these are widely seen as stimulant medications since they're designed mainly to increase the short-term activity of particular neurotransmitters in your brain, in your nervous system. So if you think of chemicals like dopamine or adrenaline and noradrenaline, these are chemicals that are elevated in your system when you're more active, when you're more alert. In particular, when you're stressed, it triggers your body to release an extra amount of some of those chemicals because those chemicals are kind of energizing you to be able to respond to the stresses of your environment. But of course, if you're in a chronic state of stress, that starts to wear down your body. It starts to deplete your ability to think and concentrate. So while you get this short-term burst of energy, and for that time you might be focusing and active and getting things done, if you're stuck in that state in a longer amount of time, it tends to lead to the opposite effect, where your functioning will diminish. You start to get more and more depleted in some way. So you can think of some of the drugs or medications people use as giving them kind of this emergency extra burst of energy to respond to a stress. Hopefully that's just for a brief amount of time, for a short-term emergency. One example would be someone who's serving in the military, and for their military training or in combat, they need to stay awake and alert for a very long period of time, let's say 24 to 48 hours in the middle of a battle. They can't rest or go to sleep. They have to keep themselves awake. So that person might take some type of drug designed for that effect. They might take an amphetamine type drug They might take some high dose of caffeine, so something that's stimulating the nervous system. It's actually stressing them to stay alert when the body, under normal natural conditions, would seek to rest and sleep. You're keeping it awake. So if you try to continue to do that continuously, it's going to lead to a lot of negative health effects, both physically and mentally. It's not something that's sustainable, and eventually you're going to pay the price for doing that in some way. You could think of the example of someone who's preparing to take a test, so they didn't take time proactively to prepare, and then at the last minute, the day or the night before, they find some time to try to study and have some preparation. So they take some stimulant to keep themselves awake and alert so they can focus enough to study and at least retain some information before the test. That's not an ideal way to study. So under the influence of those medications, you can be alert enough to study, but you're not actually absorbing and integrating the information as well as if you studied in a more steady, proactive manner where you didn't take any medication to keep yourself alert. So if you're in a more balanced nervous system state, you're able to study and retain that information better and actually perform better in different cognitive tasks. There's a significant amount of research on people who use ADHD medications showing that it may improve their focus, their ability to stay on task in some ways, at least temporarily, but actually their cognitive skills are not improving. So it's not actually making their brain work better. It's actually just keeping them alert at a time when they might otherwise have naturally been less alert and less focused. Another example of how using a medicine for an emergency short-term effect may seem reasonable, but if anyone continued to use that medication longer, it would lead to many negative impacts. We can consider a person undergoing a surgery where the surgical procedure is invasive. It would create a lot of severe pain at the time of the operation, so someone's given anesthetic so they're not overwhelmed with pain as that procedure is carried out. So it's something given for that short period of time, but there's negative effects on our body from anesthesia, and if we continued to use these numbing chemicals or pain-suppressing chemicals for a longer period of time, it produces various harmful negative effects, including actually slowing down our body's repair and healing process. So with medications used for psychiatric disorder labels, you have a similar challenge, or something that someone might use in a brief emergency situation is actually being used chronically every day for months or years, and that inevitably is going to lead to a lot of negative impact or harmful consequences. So we're going to look at how ADHD medications are creating the temporary increase or elevation of activity of those stimulating sympathetic nervous system related neurotransmitter chemicals. So one way that they function is to stimulate the release of chemicals. Okay, so let's say you take a medicine or drug that stimulates your body to release more dopamine or more noradrenaline. So these are chemicals that kind of arouse and heighten the level of your nervous system activity. And our body, as I mentioned earlier, has its own self-regulation. It thinks it knows what amount of these chemicals it needs at any given time. So it's regulating it. If your body doesn't have much active dopamine at a particular time, and remember this is continually fluctuating over time depending on what you're thinking, what you're doing, what you're feeling. So at any given moment the levels of dopamine could be low, they could be high. It's not like your body's always in a particular state of activity. So you can do things that will kind of trigger or stimulate your body to increase its release of a particular chemical. And different drugs or medicines can do that, but they're doing it in a way that's in some way stressful to your body. So if you take cocaine, for example, that's going to stimulate your body to release more of its nervous system stimulating chemicals. But it's doing that in a way because it's toxic to your body and your body's reacting with its stress response. So your body is stressed by this chemical you're putting into it, so the nervous system gets stimulated as your body's trying to cope with that chemical. So yes, you're releasing more of these neurotransmitter chemicals, you're more alert, and you might start to desire that feeling or effect, that state of being stimulated, of being more aroused. But it can go to an extreme where you become really kind of manic or psychotic because you have this overload of energy going through you from this chemical overstimulation, and you're also not really listening to your body, to what your body felt it needed in terms of its level of activity. If you continue to do this stimulation, what can happen is your body could adapt to that because your body doesn't really want to be so overstimulated, continually releasing extra amounts of those neurotransmitters. So your body can try to protect itself from that drug effect by reducing the amount of receptors for those neurotransmitters. And then when it does that, the drug starts to have less effect. So there's this tolerance that builds up where you would have to keep taking more and more of the drug to attempt to get the same level of effect because your body's trying to compensate or override what you're trying to do with the drug to protect itself. So it's trying to reduce the potential for the excess of that neurotransmitter. It's reducing its ability to actually produce those neurotransmitters. And then when these drugs wear off, you have a good chance of having very unpleasant withdrawal effects because now you don't have that drug there trying to stimulate the release, so your body's going back more toward its own natural level of chemical synthesis, but you have fewer receptors now, so your body is going to have a harder time building up to even its normal level of activity of that neurotransmitter. So it's kind of like you've burned out your system from continually or chronically using these foreign chemicals. Now there's a couple other modes of action we'll look at here. So the next mode of action is reuptake inhibition, and that phrase has become somewhat well known via some of the antidepressant drugs, which are labeled as reuptake inhibitors. In that case, it's serotonin, so they're selectively suppressing, suppressing the reuptake of serotonin in order to get the serotonin levels to rise. So serotonin is circulating, and normally your body regulates it by withdrawing it from circulation so it doesn't get to too high a level of activity. Well, the same thing can happen for other neurotransmitters, where you can give a medication that interferes with that reuptake as a way to increase the level of activity of that neurotransmitter. So rather than giving a stress to force the body to release more, to create more of the neurotransmitter, you're just causing the existing neurotransmitter that's circulating in the system to continue to circulate and not get broken down and withdrawn from circulation. So that's another way that some ADHD drugs or other medications can increase the activity of these particular neurotransmitter chemicals. And this creates essentially some of the same dangers as you create by trying to force the body to release more of those neurotransmitters. By artificially increasing the amount that's circulating in the system, that level can go too high, and your body will be alerted to that and try to compensate by reducing the amount of receptors there, so then you can have bad withdrawal effects if and when you try to stop using the medication. So it fuels very frequently some form of dependency or addiction, where you become dependent on trying to use more and more of a drug to maintain some stable level of functioning in your life. So this is a definite danger of psychiatric medications, including the various ADHD medications. It's a very well-known and obvious hazard of recreational drugs, and it's kind of masked or hidden more with prescription drugs, because when you're given a prescription, the doctor is guiding you to carefully sustain your use of that drug. So you're using it on a regular schedule and a regular dosage. So you're not allowing yourself to go through the withdrawal effect for as long as you're continuing to follow that prescription. So your substance use is being very carefully managed, per se, in such a way as to reduce the chance of those negative effects appearing. A person using drugs recreationally will often not be consistent about how they're using it. They'll take it for a period and then they don't have access for one reason or another. They go into a withdrawal and then they start using again. So they're on these kind of cyclical swings with it. Whereas if a doctor is having you carefully maintain a steady schedule and steady dosing, that can kind of cover up the harm that this medicine is potentially doing to you. You're ensuring that you don't encounter the withdrawal effect, but then if at some point you can't access the drug, you can't afford it, whatever might arise, then at that point you may end up going through some severe withdrawal as your body adapted to the presence of that foreign chemical, and upon removing it, your body is now more out of balance than it ever was to begin with. So the medication is not actually fostering balance. They're all actually disrupting your own self-regulation, your own balancing mechanism, which leads actually to more likelihood of imbalance in the long term. You're just covering that up by continuing to use this medicine, continuing to compensate for whatever state your nervous system is in. So with ADHD, they keep creating new medications as people look at the existing medications and see different side effects or negative effects of those medications, and people are constantly hoping to find something that will treat their symptoms and not have as obvious or apparent negative effects. But really none of this is a solution. You're not actually addressing what's giving a person stress, what are the biological and psychological stresses that you really need to address to help the person have better self-regulation or internal balance in their body and in their life. So this is why, as a holistic-oriented therapist, I focus on those aspects of treatment. I'm not here to give you a drug to control your temporary neurological state. I'm not trying to manipulate behavior. I'm working on helping a person improve their lifestyle, helping them balance their energy better, helping them shift their consciousness in some way to have a more healthy life, to have more resilience, to have a more moderate amount of stress where their body's not getting overwhelmed, where they're not swinging from one extreme to another. So that involves looking at stresses in our life, stresses in our diet, and our sleeping patterns, and whether we're spending too much time indoors and sedentary versus getting exercise and being outdoors, getting natural light. All these different factors affect our biology and our psychology. If you're just giving some type of medication, then you're just trying to fool yourself in a way. You're denying what your body is showing or telling you, and you're ignoring some of the underlying things in your life that you may really need to work on changing. Coming back to the discussion of the medications, there's one more mode of action that I'd like to discuss, and this is what I'll call the analog effect. So we're using the word analog here to refer to a chemical that is simulating, it's an analogy to the body for another chemical that the body itself would normally and naturally be using. So you can have some type of drug where the chemical compound in that drug is very similar to a chemical compound that your body naturally produces and uses. So in this case, it could be an analog for a hormone or neurotransmitter. And when you give that foreign analog chemical to the body, then that chemical can bind to the body's receptors in place of the natural chemical your body would usually use and have a similar effect to that chemical. So if this analog effect occurs, it can actually lead to significant confusion in your body where you're getting this effect from this foreign chemical and your body has to figure out how to adapt to this situation. So one way of adapting is your body could decide that it's going to greatly reduce or limit its production of its own chemical because you're flooding the system with this foreign chemical that's producing that same effect, binding to the same receptor and so on. So if that happens, that's kind of dangerous because then if you withdraw, you stop taking this foreign chemical that you put into your system and your body could stop producing its own chemical, you're going to have this major crash, a withdrawal effect, where now you have very low levels of this chemical that your body was normally producing for itself. So it's not wise to give your body these analogs. Your body can easily get thrown out of balance by doing that, even though when you initially took it, it might have given you some desired effect where you think, okay, this has given me some balance, some equilibrium, some state of better functioning, but it did that at a great cost where the long-term effect is going to end up being the opposite, where you're going to be in an even worse state of functioning than you were to begin with after that drug effect wears off. So we want to get back to nourishing our body with nutrition, with what your body actually needs and uses to maintain its own chemistry, its own self-regulation. You want to address stresses in your life, so anything that's interfering with that sympathetic, parasympathetic balance of activity in your nervous system. You also want to address any biological toxicity, exposure to things in your food, in the air, in the water, and medications you might be taking that are disrupting your body, that are impacting your nervous system in a way where you're chronically stressed and not able to come back into more of a balanced, dynamic equilibrium. So for those that are looking for holistic approaches to ADHD, those tend to fall into multiple categories. There are some of the biological medicine approaches which involve diet and nutrition and detoxification, helping improve your digestion, removing chemicals from your diet, from your environment. There's also emotional and mental factors. So obviously if you're in a stressful family environment, or a stressful school or workplace that could affect your nervous system and how you're able to concentrate. I see there's really a significant overlap between the ADHD symptoms people label and anxiety symptoms or insecurity symptoms. So a lot of it has to do with our sense of self, how competent and confident we feel. If you're anxious and insecure, that makes it more difficult to focus and concentrate. So anything that helps a person handle stress better, helps their body and nervous system relax more. So relaxation is more therapeutic than trying to give drugs for stimulation. The stimulation is actually interfering with the natural cycle or sequence of refreshing and rebalancing, whereas things like massage and sound therapy and Reiki and acupuncture, some of these other alternative approaches are actually helping the system rebalance itself, and in the long run those are more supportive or conducive to recovering from the label of ADHD. Also meditation and mindfulness skills, so learning to be more present, learning to release some of that anxious mental chatter. Those are valuable skills. Using neurofeedback and brainwave entrainment, so learning to regulate your own mental activity, to shift your own attention or focus rather than forcing it on a chemical level with drugs. If you learn to manage yourself, that's a skill that you're always going to carry with you, and you won't have this belief, this dependency you're creating with the medicine, where you believe that you need this foreign chemical to enable you to function. Especially for children, it's not healthy to give them this message that they have some disease or disorder or defect of something wrong with them that they need a drug for, when in reality they've just been naturally reacting or adapting to their environment, to whatever stresses they encountered. And if you put the blame on them, if you shame them for their natural response to their environment, you're teaching them to be disempowered. You're teaching them that people are going to look at them as the problem rather than the whole interaction of that individual with their environment, and everyone taking some responsibility. With ADHD drugs, as I mentioned, the withdrawal effects can be rather significant and disturbing. So if you are on the medications, it's usually not wise to just try to abruptly quit. It would be helpful to find healthcare providers who can help support you through the process of tapering or weaning off of those, if that's something you choose to do. There are some people who do manage okay with just abruptly quitting, but others who very much struggle and have difficulty. So you'll want to have support and resources available to assist you if you have challenges with that process. So I encourage you to find practitioners, healthcare providers who are knowledgeable and well educated and who can work with you on these different dimensions or aspects of holistic care, so they can address things physically, emotionally, mentally, and spiritually to help you go through your healing process. There are those multiple dimensions to our functioning, and for each person there may be one or more particular level that are vital or key to address, so you can explore that for yourself. What are these aspects of my life where I need some more support or assistance? It could be your food, your diet, your nutrition. It could be the skills you have to handle social stresses. It could be your core beliefs about yourself, your self-worth and self-confidence. So we can look at all those different aspects in approaching a holistic therapy regimen for those that are dealing with ADHD. I appreciate each of you for taking your time to explore this topic. This is a very common issue in our society of dealing with these types of symptoms and the different viewpoints and controversies over how to address those concerns. I hope that the presentation here has given you some insight, some enlightenment about this, some awareness of what are safe and effective ways to address those concerns, and to understand the hazards and risks of some of the common medical practices that many people have been using. For those that are interested in holistic health and wellness and additional resources, I invite you to visit my website, phinsights.com. That's phinsights.com. For now, I wish everyone a wonderful day. Namaste.